Joint aspiration is a vital part of evaluating a patient who presents with a joint effusion or signs suggestive of inflammation without an obvious cause. The most important reason to perform an, a joint aspiration is to evaluate for septic arthritis in a patient who's presenting with an acutely swollen joint that is painful and warm. Joint aspiration is also helpful in evaluating for a patient who you suspect may have gout or pseudogout. And in general, it can help you classify the swollen joint as having inflammation, as not having inflammation, or perhaps to diagnose a hemarthrosis. Lastly, it's especially important in evaluating for chronic infections such as tuberculosis. As you can see in this picture, the synovial fluid of a patient with inflammatory arthritis appears blood-tinged and quite murky due to the presence of white blood cells. The synovial fluid of a patient without any problems or of a patient with non-inflammatory arthritis should be completely clear like water or maybe a little bit yellow, never bloody. The joint fluid, once it's aspirated, should be sent to the lab for cell count, gram stain, culture, as well as measurement of glucose and uric acid. If the patient is presenting with chronic arthritis and you suspect tuberculosis, you should also send it for acid-fast bacilli stain and for tuberculosis culture. Glucose is routinely measured in the synovial fluid, and the glucose concentration of synovial fluid in a healthy patient should be similar to that of serum. As a result, it's really important to always measure serum glucose at the same time as you do the joint aspiration. In addition, uric acid is measured for evaluation of gout. Uric acid is significantly increased in gout, especially in the joint. It may or may not be elevated in the serum of a patient with gout, but identifying uric acid crystals in the synovial fluid in fact confirms a diagnosis of gout. Although in my experience this is not widely available in the global south, if your hospital does have access to a polarizing microscope, the synovial fluid should additionally be sent for examination to identify crystals which are commonly seen in gout and calcium pyrophosphate disease, otherwise known as pseudogout.